A mental health crisis in 2022, that's what experts say we are experiencing right now. What's the data behind that? Well, 60% of psychologists recently polled said right now, when they look at the books, they have no openings to accept new patients.
It's pretty incredible. And on top of wait lists, budgets are tight. Allison Gormley tells us what's the deal with the different types of services and what ways they can try to get help sooner.
Outwardly, Greta's life looks great, but sometimes it feels like the walls are closing in on her.
I feel like I didn't have a lot of breathing room.
The stay-at-home mom of 3 boys is new to Indy. It's their 4th move as a family.
With my youngest starting kindergarten, I knew that this was like a mental shift, a life transition.
And when life transitions happen, Greta knows it's best to get a hold of her feelings before they get a hold of her.
If one person is having a hard time with mental health, then everyone is going to be dealing with the repercussions of that.
But sometimes it's tough to navigate what you need or what kind of mental health services might be right for you. A counselor often handles specific issues like addiction. Therapists and psychologists approach overall well-being. And a psychiatrist is a medical doctor who can prescribe, but will likely need a referral from your primary care doctor. So how do you find someone? If you want to start with counseling or overall well-being, check with your employer. Do they offer an employee assistance program, or EAP for short? EAPs provide you with a number of free sessions, but then you pick up the cost. If that's not an option, look to your health insurance. While an in-network provider might include local professionals, some insurance companies might also cover online services. With cash pay, online services are still a good bet, or talk to a local provider, but ask for a discount ahead of time.
Don't wait till after the fact, right? It's much easier to have that discussion before you even see.
Medical billing advocate John Hess said you can also pay for services with pre-tax dollars.
You have access to an HSA or an HRA or an FSA, you can use those dollars to pay.
Online services are usually cheaper and quicker than in-person visits. Greta, for example, uses the online service BetterHelp.
Even if you do just the trial for 7 days, it gets you talking,
helping her family navigate a new city with her best foot forward.
Now, if you're concerned about paying for resources, try calling 211 and call around to local churches to see if they provide faith-based counseling.
Absolutely. Thank you so much. Certainly some good tips for people too. It's been a lot of change this year.
A lot of
Let's
change,
just cut to it. It's been a lot happening.
If you haven't done it before, you don't know where to start. And you can only be turned down by so many people until you get defeated and stop the process altogether.
I use what our employer allows us to use, and it's just been a game changer.
Yeah. And ask about the benefits, because you don't want to go on a waste.
That's right. And we're coming up at the end of the year. And that mom said, even if it's just 7 appointments or something, you get the conversation going, that can make a real big difference. Allison, thanks so much for your tips. All right, Angela, love the sun today, but boy, oh boy, were those temperatures a little low.
Ooh, yes, they were. We didn't make it out of the 30s, and that's where we're going to spend this evening.